And I am so grateful to Matt Curtin and Robin Parkin for joining us here today for this chat. I have worked with both of you for the past 10 years of my career in Virginia. And I was sharing with Matt the other day that I became involved with the board because we were over in that corner when the room was flipped the other way. And he walked up to me and he said, "Hey, UVA," because I was at UVA at the time. And we started talking about the board. And Robin, I met you when we both started at UVA the same day. So these guys are top notch. They're going to share some really good information with us this afternoon. And please do hang in, because then we're going to do our vendor giveaways. And Matt, that's the fun part of the thing, right? Like, yeah, I hear there's drones and whiskey. So Robin probably tried to sign up for the drone. She's like, drones and whiskey. So thank you for being here. Yeah, it is an odd, you don't do them at the same time. Maybe the same person doesn't get them, although that could be fun.
Yeah, I mean, it is Virginia. You got to be careful out there. So I do recognize that just like everybody who presents the last session on day 2 of a 2-day conference, besides very high value golf outings and an innovation workshop tomorrow, we are required to say, I apologize that I'm standing between you and, well, I would say some alcoholic beverages, but I just saw some very compelling data that reminds me of nutritional content and mitigation by the minute per drink that this has on my life. So I'm Matt Curtin. I joined the Virginia HIMSS board, probably 14, 15 years ago. I moved a few time zones to the left, so I'm no longer local, but it's very nice to come back here to Kingsmill here at Williamsburg. And I have the profound luxury of chatting with Robin Parkin, the Chief Information Officer, formerly Chief Information and Technology Officer at the University of Virginia Health System, Mr. Jefferson's health system, if we're just going to get really specific here. A little bit about myself. Well, I'm going to pose a very obvious question that I ask myself in the mirror every day, which is, who is Matt Curtin? I would imagine all of you all are asking the same thing. I have a health administration background. I've spent years in technology, digital, cybersecurity, analytics, strategy consulting. I have the pleasure of working with a number of large health systems and leaders across the nation. And I'm going to put you on the spot, Robin. I have to share with the audience that everybody with whom I've worked, you've been one of my biggest inspirations. You've made me keep my game tight, to say the least. My answer's tighter. So if I appear nervous at all, it's actually because Robin is going to answer things very succinctly, very crisply, and I'm going to have to rely on you all to ask a few other questions. So I'm not going to try and I'm not going to give your entire pedigree here. If you wouldn't mind just sharing with the audience a little bit about what is your current role, maybe even a little bit about your background, let's say with boating companies. Your first job.
My name is Robin Parkin. I've been at UVA for 10 years. And prior to that, I was in Eastern North Carolina at what is now called East Carolina Health. Before, I worked there 30 years. I actually retired from that organization and ended up at UVA. But before then, when I first got out of college, I took a job as a programmer in a boat manufacturing company. It was Grady White Boats. They make lovely boats, but it was a boat manufacturing company. So I think I was there a little more than 6 months and did not really care for the job that much. I mean, I love what I did, but there wasn't any real value to me. I needed something that I felt like I was making a real contribution and that it made a difference for the part of the country that I lived in. And so I started applying to get jobs in healthcare. And that is where I ended up at the county, what was then the county hospital in Greenville, North Carolina. And as I got in is when it started turning into a health system. So I have been doing health system IT for now 41 years.
Amazing. And would you mind sharing just a little bit about what is your scope in your current role at UVA Health?
Sure. So, as the CIO, we are responsible for the majority of IT for the academic medical center, for our physician group, for the School of Medicine, and for 3 community hospitals. We have clinics and a dialysis center, so I've learned just the last few days, all over Virginia. And the reason I say dialysis centers is tomorrow morning, Tracy Patterson, who is sitting over here to the side, is bringing them live on Epic's dialysis product and getting him off of a third-party product. So that's when I found out we have 13 scattered dialysis centers all over Virginia to go support tomorrow. But we have standalone imaging, we have behavioral health, we have a lot of different services that are outside of the hospitals, but my IT organization is responsible for all of that.
So we've come here to Kings Mill these past couple of days to talk about various topics under a theme of better tech for better health. That's kind of our, branded why for the last 48 hours or so. Robin, what's your why? You had a great career at Vidant. You've decided to enter the fray of an AMC leadership role. What's your why?
So why did I do it for another 10 years, or just why did I?
Well, however you want to say that.
So I think I mentioned the fact that I didn't care for boat manufacturing. My undergrad degree is in social work. I know that seems odd that I ended up then going and get my master's and getting yet another degree. So I've got really 3 different degrees. It didn't feel like I was contributing anything. So what was important to me was to be in a role and to do something that I felt like was going to make my community better. And I was an Eastern North Carolinian, so the mission of our teaching hospital there was to train primary care physicians to go out and work in the 29 counties that we supported. So that was my why then, but I love what I do. I personally believe that if you don't love what you do, you should start looking.
Do you have a Grady White?
No, no, I do not have a Brady White.
You know too much. So you have the opportunity to interface with a lot of your peers across the industry. I see you at a lot of events nationally. I know you're piped into some of the better practices, especially around leadership. And leadership right now is kind of interesting. Gone are the very rigidly defined days of a chief technology officer that then morphed into the CIO role. Now we're seeing some combination of digital technology, some sort of analytics stewardship or AI leadership. But out of all of that, when you meet your peers and you're talking with them, what are some of the attributes of some of the best leaders across the country that have roles like yours?
They have good relationships, not just internally within their organizations, but they have developed really good relationships with partners that they work with that help to provide services for them. We were talking about that earlier. We have a tremendous responsibility, and there's always things coming at us that we don't know what the answers are. And we need to have help chains. We need to have people we can reach out to. So when I look at the people that I see at conferences, I have my colleagues who are maybe our CIOs or specialized in something in the healthcare IT space. But I also am looking at those vendors who are real partners that I can pick up the phone and call them and say, I have this problem. Have you ever done this before? Or what is the right thing to do? And try to get better answers. So I do think that it takes a lot of relationships and understanding because there's nobody that knows all the answers.
I think
That makes
that's a
sense.
really good way to describe it. How would you describe a true strategic partner? Like, can we pull that thread a little bit more?
We have a few, and they are people who I may actually do a lot of business with them, but sometimes it is more about the relationship. And they are people that if I wanted to hire somebody, I might call them and say, "Do you know this person? Do you know who may know this person?" If I want to buy something, I may find out that they have used this product before, and will ask them for what their experience has been. It's a lot better than going in cold and finding it all out for yourself.
Yep, I don't know if anyone who is around the periphery was taking notes, but that's your layup for the day. Um, so let's dive in a little bit here. You put in a lot of effort, and your team has done a lot of great work around building up the right foundation, getting the core elements in place for continued evolution. And we heard a lot the past 2 days about advanced tool sets, advanced analytics, A1, which is, I put
Love
AI on my steak. A1 is what we talk about here. Whoever made that joke was great. So let's talk about what you all have done to get your house in order, prepared for the next generation of tools, solutions, and technologies.
So internally, one of the things that is really important is getting the alignment that you need within your own teams. So you need one, hire good people. You need good people. You're not going you can't be everywhere. You can't know everything. You need to have really good leaders in your organization. And that doesn't mean the role they're in. It doesn't matter what level. There are leaders everywhere in our organization. And in addition to that, we went through a lot in terms of we've done a lot to make our processes a lot more rigorous internally around how we manage change, how we do technical reviews, and really get a good understanding of what it is that someone wants to purchase or what we are being asked to implement. Um, we even, when we started to hear the rumblings that we were going to buy hospitals, UVA had somewhere in the vicinity of 6 IT departments. I was just one of them. And I had to go to the leadership and say, "You can't do this unless you're gonna fix that, because we will never be successful if we have to negotiate with 6 IT departments on who's gonna do what when." So we pulled all of those people into our IT. We have one IT today. There are still like informaticists and others outside of our organization, but that was key to us being able to get work done and to move with some speed because that was really important for this particular acquisition. And then there's also I'll say, preparations. What I keep telling you, sometimes you have to go slow to go fast. Um, is to take the time and look at how what is are your products installed properly? Are they up to date? Have you modernized the things that you need to modernize? And is your data clean? So is your organization using those tools in such a way that it's going to support AI when you lay it on top? And in some cases, we know that's not true for UVA. And we'll need to do any number of things to try to be sure that we get that done.
Do you have any examples of a time that you intentionally slowed something down to take a good look at something, and then you saw a return and acceleration on the other side of that?
I think that so UVA is an organization that, you approve a project, they think you're starting it tomorrow. And so part of what we've been working on is trying to be sure that we are going through all the steps. We are standing up that we've got the right people at the table. We have good governance. We understand what all the pieces of work are and how they relate to each other. It's really just real good project management. And then throughout the day, we've heard a lot about organizational change management. And that is, that scales with your projects. But most of the projects that we do today are more enterprise. So they have a lot of organizational change management involved in them.
And since you brought up the importance of good third-party strategic partners, are there any messages that you would share with the vendor community here on how we or they can best prepare for any sort of review or any sort of integration into your workflows so that it can go faster in the long run?
So I think sometimes the vendors that I speak to don't put themselves in my shoes and think about what is it that I need. What they need is to sell me something. But sometimes what we really need to have happen is for them to, one, come really prepared. And I have had CIOs that said, if you can't get my attention in 30 seconds, I'm gone. And I'm not sure I would be quite that.
You give up to 35 seconds? Yeah, it's very generous. Oh, yeah.
But being prepared and being ready to talk about what you can bring, what can you bring to the table to help me with my problem, and taking the time to understand what that problem is. That's really important.
Yeah, and we talked earlier about this, and there's a critical component to your role, which is facilitating progress and facilitating activity that supports a corporate or enterprise initiative. Can you tell us just a little bit about how you secure that buy-in from your leadership team when you need to demonstrate an investment that would further a strategic objective? Like, what does that look like on your end?
So I'll use the example of we want to buy a product. And what we are trying to get, and I'm not saying that historically it's always been this way, but what we're trying to accomplish with our leaders is that we will sit down with them and define what their requirements are, and we'll go to market and bring them products and show them so they can make because I don't get to make those decisions. I think that sometimes the vendors that contact me think they're going to talk to me and I'm going to say, yeah, sure, we'll buy this AI for cardiology. That isn't going to happen. All I do is facilitate and open and close doors. And at the end of the day, what's really important is that we are buying the right product, that we're using the products we already own as well as we possibly can, because we do have a tendency to be attracted to shiny objects.
Yeah, so I think it's really interesting to get a peek at how this process plays out behind the scenes. So by the time a lot of us hear about an initiative, by the time the vendor community sees that RFI or that RFP, there's probably been months and months of consideration prior to that moment. Can you just kind of talk us through, like, what does that journey look like even before you get to a point where you're going to make an investment decision or a purchase decision?
So that's become a lot more complex. One, the velocity of what people want is just through the roof. And so I love the definition of focus today. I think that's really important, and it's important for my organization as much as it is for any. We have a lot to do, but we don't have unlimited capacity or money. So we have to be selective. One of the things that we are doing now in August, all of my team did a retreat and we started working on our roadmaps. And the next step for that is for those roadmaps that might relate to a particular area of my organization that they're going to go sit down and talk about those roadmaps and get alignment or not get alignment and know that they're not going to be doing that thing, whatever it is. And that is all in front of our budget process. So the idea is for us to have some set of things that we know we want to accomplish in the coming fiscal year and be able to do that and have it planned for before that fiscal year even begins. Now, granted, there's always going to be the things that drop in out of nowhere that you need to do. But for the most part, we should know what we're going to do in a fiscal year for the majority before the year begins. We should have a plan. We should be able to schedule those all out, understand that we have the capacity, or if we need to ask for additional FTEs or contracted resources, we do that. But having those changes in how we plan for the fiscal year is really important for us because we've got a lot of players at the table now with 4 hospitals versus 1.
Sure. So you've put a lot of effort into getting ahead of the, that terrible budget phase crunch. So now you're starting this a lot earlier. I would imagine that once you go live with an effort or a program or a project, it's incumbent upon you to demonstrate that value. How are you able to measure and show value that points back to that very process that you accelerated on the front end?
I don't think
I
we
just
do
made that up.
very well.
Okay. Really?
I think, well, some parts of our organization do a great job of developing business plans. Our pharmacy department does a fantastic job doing that. Others, not so much. We have actually talked about training for our senior leaders on how to do that kind of work because they know their vertical, but they don't know about business planning. And so, it's sort of something that you would expect a senior leader to be able to do just logically, even if they don't know everything to put into a business plan. But the bottom line being that we really don't have the maturity, maybe not the rigor or resources that come back after, even if we say this is the ROI, to be able to demonstrate that we accomplished what we thought we were going to do or don't.
Right. Yeah, that's important. And I know this may shock folks, but a lot of people in healthcare come up through the ranks. They're legacy folks. They haven't necessarily been given the opportunity to understand what is a high quality business plan, how to define and measure goals. And I would imagine there's a good bit of handholding that needs to happen to make sure that things are done consistently and people are bubbling up the highest priorities and communicating why they're high priorities.
That's why I was so excited about the no. I do. So we do have a process and we have 5 subcommittees that are in different domains, and project proposals go to those 5 subcommittees and they decide which ones they're going to scope out and push into the leadership approval process. That said, there are so many of them. What they do is they let the ones that they have not chosen sit there instead of ever saying no. And and we are actually having conversation about that right now, because some people get pretty spun up when they never hear anything from you, and they put a proposal in 6 or 8 months ago, and then maybe at the end of the year we close them, and we write them an email and tell them, we're sorry we didn't get to this year. If you want to do it next year, you need to resubmit it. There really needs to be a lot more structure to that. It's if I was someone who thought something was really important, I would really like them to reach out to me and tell me why they couldn't do it.
So is it safe to say that right now, and especially given what we've heard the last few days, the pace of change, the rate of change,
Insane.
can the workflows and the governance models you're explaining, can that accommodate the rate of change?
No, we don't have the capacity. And I think that even if we could do it all, I don't think the organization has the capacity to absorb all that change. But we haven't been since we don't have all those resources, we haven't tested that yet. But I do think that what we run into is, we have probably over 30 active projects right now. We probably have another 10 or 15 that are scheduled and waiting to begin. But there's probably still 100 that are sitting if you added them up across those 5 subcommittees, that are just sitting there. It's just the volume of things that people want.
I'm very much understood.
And I think some of that could be too, during COVID, we didn't really do a lot of things like we didn't buy products. We were doing things like trying to figure out how we were going to go test students, and how we were going to inoculate or at somebody's church and stay in those. We did all kinds of things like that, and it was fast and it was continuous. And it's sort of like after that, then there was 3 hospitals to be acquired. And now we're beyond that. And now it's like everybody says, okay, let's go. And now that's where we get this volume.
So when you look back on the last, let's say, 4 to 7 years, and let's assume that you were able to observe some practices that were good, some practices that were bad, you were able to refine processes and workflows, governance, change. What do you think then the next 3 to 7 years is going to look like? Like, how has that influenced what information technology, information systems, whatever an organization calls that? What's your world look like in the next few years?
So what does UVA's world look like?
However you want. This is your chair.
So I would say, one, you'll continue to see IT processes improve, mature. I also think that UVA will also mature from the perspective of learning to say no. I don't think they're going to have a choice. And we already have some voices that are saying we need to get better alignment, because really what we have right now is a lot of projects. There are no bad projects in that queue. So it's not like we're doing something and, we're going to go rip it out. But yeah, so those things will happen. I think we'll continue to grow as an organization. I think that is a pretty much set, and we'll continue to do that. And in the processes that we have, we may find that we have to be a little more flexible in how we do work. Maybe we'll have some kind of decentralization, not necessarily not underneath the umbrella of health IT, but they may be aligned differently.
You can say federated.
It may be the best way to be agile.
So I don't think it would be a HIMSS CIO fireside chat if I didn't ask you, where do you see the role of the CIO going?
So I have a lot of colleagues that are CIOs that are much more involved in day-to-day operations than I am. Many of them are taking on IT and other services as well. And and just because a lot of organizations are shrinking their most senior level group and trying to be more efficient. So IT job from a CIO perspective is going to change along with that. I think that, I know I have colleagues who are responsible for the cafeterias, parking. We've already taken on clinical engineering several years ago. But I expect that things that don't even feel like IT could end up rolling up to CIO.
Yep, I think that that's a pretty broad trend as well, especially when you look at anything that's consumer, patient facing, marketing, communication, etc. Before we open this up for questions, I want to make sure that everybody has some time to raise their hand and grab a mic. Do you have any other final thoughts, anything I didn't ask you that you'd like to share? Absolutes loaded, very loaded.
So I have to say that I have been in Virginia for 10 years. I'm a native North Carolinian. I am going to walk out of the door of UVA in about 4 months and retire. I have well, thank you. But I have so enjoyed working here in Virginia with the different organizations that we work with all the time, and with Lee and others, and also just the work of. I will tell you that being in this role is one of the things in North Carolina. The roles, it was not an academic medical center. The biggest learning I have had in the last 10 years is academic medicine. It is a different animal entirely. And it has been probably the most life-changing of any of those. But I have really enjoyed working with everyone that
Well,
I've met here.
it's been an honor to have you participate so frequently, and you've been so engaged here with the Virginia chapter. Let's make sure we've got some time for some audience questions or tomatoes to be thrown at me. Definitely not
Don't throw
Robin.
any at
No,
me.
don't throw any. Yeah. Somebody's got Ruben. Yes.
Ruben?
I'm kind of like you. I'm going to retire in about 4 months or so. But my question to you is, like I've been in an organization for 30 years. You were at an organization for 30 years. What prompted you to come back into a major role?
Oh, there's a story there.
Okay.
So in 2015, I decided that it was time for my son was graduating from college. Nobody was home except my husband, who was on the road working all the time anyway. So I was like, I think I want to do something different. And so I retired from what was then called Vidant Health. And then a friend of mine, I turned in my resignation letter. A friend of mine who was a recruiter, who had recruited for me for years, was talking to me one day about was I looking to hire anyone? And then she said, "What are you going to do?" And I said, and then I told her I had just turned in my resignation. And she said, "I have this CIO in Virginia, in Charlottesville, you need to talk to." Because when I came here, it wasn't as a CIO. I came here to install Epic. And so they had done all of their clinical systems, but had never done any of their revenue cycle. They were still on the old Siemens system. So I came up here and said, I'll stay 2 years. And here I am.
All right. I know there are more out there.
I'm Casey Bunn. You talk a lot about personal value, which I love, and why you keep doing what you're doing. But I'm just curious, is there anything when you talk about budgeting too and prioritizing that, is there anything that's really on your radar that you're like, no, budget is not getting cut from that because your personal value associated with accomplishing that is so high you just wouldn't let it go? I'm just curious.
So, not exactly like that, but I will tell you that we pursued doing Microsoft DAX for 2 years before we actually ended up, the price did come down. So we kept at it for a long time. And because we thought it was so important, we did we tied ourselves in knots to try to get that to happen. And finally, that's another thing Tracy Patterson's working on. And we just have a lot to do to finish rolling that out. But I have a good friend that is, he came and spoke to you from the Lorna Brain Foundation, who was in Charlottesville. And he and others that were part of it were really interested in physician burnout and the things that we can do to try to make caregivers, not just doctors, but all of our caregivers' lives a little bit easier. And so if you can't take care of patients, there's not a better job than taking care of people who take care of patients. And it's just, not everybody's cut out to be at the bedside. And I know I certainly am not. I would be on the floor passed out every day for some reason or another that happened. But I just think that I think you have to be joyful in the work that you do. And if you're not, then you just need to look first. You need to find your fit and where you belong.
Hi, good afternoon. I'm Christina Lepre. I'm from the Northern Ohio HIMSS chapter and a company called 3LC Solutions. Thank you for everything today. You've been incredibly inspiring. Casey and I last week were actually together at the Bluebird Leaders SOAR conference.
Oh, awesome.
Okay. Awesome event for any of you ladies in the room and our allies. But it was really about bringing women together in healthcare IT and helping women empower women. And just hearing your story, what advice could you give to other aspiring leaders in kind of your journey, how you got here, who you brought along with you, or who kind of brought you along, and what is something for you that you wish you would have known sooner that you feel could have catapulted your career?
Oh, there's so many things. One, it's not always about you. That's one of the first things that I have learned. It's really easy to be offended. Don't be. Because you don't know what people's motivation is. And there's probably a whole lot of reasons other than they want to pick on you or do something to you that is driving whatever decisions or whatever it is that they're saying. That's I think the most personal one. I do think too that, we have just a lot of opportunities. And from someone who wants to be in healthcare IT, one of the biggest things is you've got to be present. I mean, I'm old, so I believe in showing up for work. I don't believe in zooming in. I mean, and I get it that people need to be able to do that and it is convenient. But when I go to hire the next whatever leader that I need, it's going to be the person that was sitting at the table. And people may not recognize that that's how they feel, but I do think that when they know your name and they know your face and they have experienced you personally, because it's almost like when I meet you in person, I'll remember you. I might not remember you from a Zoom call. So I could keep going, but I'll stop.
Yeah, what do they say that you rarely remember what somebody said, only how they made you feel?
True too.
Yep.
Now is it on? So thank you, Matt. Thank you, Robin. Renee,
Yes.
VCU Health. When you shared about your active projects, the number of projects that are queued up for the next quarter, and then all the projects that are just sort of hanging out there in limbo, that really resonated with me. And I know with a lot of the people right here at this table that I work closely with. And can you share some tips and lessons learned of ways to communicate back to those who requested the important projects because they're on the list? Does anyone have any good ideas?
So I mean, everybody deserves the respect of getting a response. And so the idea that just because you can't do it, maybe it's not a good idea. And so it shouldn't ever be done. Or maybe it's just simply that we have these people want to understand the why. They don't want to just hear no. So they can be pretty understanding if you can say, we have to accomplish these 5 things this year. And these things are going to drive most all of our work. And we'll be willing to look at this again next year. But if you don't tell them anything at all, they're going to think that you have just ignored them. And so, no is never an easy conversation.
I kept looking at you. I knew you were going to have a question.
It's running.
So I'm Trevor Humphrey. I've been up on stage, so hopefully people have recognized me. But I'm from Carilion Clinic, and I've worked in healthcare for 2007, and I've been coming to these for now 13 years, so not quite as many years. But I've noticed a trend, and I think just hearing you say it again makes me want to ask you this. But I feel like there's 2 types of people that work in healthcare IT. There's people who were in the clinical space and found drawn to technical, and then the rest of us who just happened into it. And we just happen to work in technology and found out by happenstance that we're in healthcare now. And we end up loving it. But I'm raising 2 daughters, and I'm trying to figure out how do we grow that side of the equation that isn't necessarily clinical. As a leader who's seen workforces come in and through the various positions, you yourself started at making boats and then just stumbled into healthcare almost. How do we do a better job at recruiting people into the healthcare IT side, not through the clinical avenue? So
And I will tell you that your clinical colleagues would really love it if you would leave the nurses at the bedside and not recruit them all to come into IT. But I do think that that's a hard one. If you in your communities have like in my community in North Carolina, we had an academic program in the high schools that brought kids into healthcare and let them experience different departments and do different things. I think things like that, kids don't know what they can do when they're older. I didn't know what I wanted to do when I was 20. So I don't think that it's necessarily you need to do anything in the healthcare system. It's outside of the healthcare system that you're going to pull them in. It's, your community colleges. It's, are the programs there in the universities? I don't know. I mean, I don't know that healthcare IT is a separate thing from IT if you were teaching a technology class.
Sorry, I completely agree. And I think the thing that made me ask the question or want to ask the question is you said that and it's the same thing that drew me and kept me in. I was going to study economics and work for the Fed. I was convinced I was going to go into econometrics and review banks and do it all. And then I was like, I got a job at St. Mary's Hospital in Richmond and fell in love with the value creation. And you mentioned that you recognize the value creation. And I don't think we in the healthcare IT space are doing a good job at connecting with that. But I really like your suggestion to get into the community.
I think too that, I see a lot of older people working in IT than when I first joined IT when I was younger. And so how do we replace ourselves? How do we get people in? I mean, you could do programs. I mean, we're doing like earn to learn program in in our hospital for different roles. We could do the same thing with the community colleges with our IT for IT in healthcare. I mean, there's a lot of things we could do. It just takes energy.
It's an opportunity rich environment. I can tell you from being in a health administration program not terribly long ago, 0% of our curricula involved IT. I did not know what it was. We didn't talk about it. When I think Lee, I think you and I even taught we had a quick class at the MHA program at VCU, and the number of questions we had about IT was a little bit demoralizing. We aren't talking about this. I mean, IT budgets constitute what, 7 to 10% of an organization's overall revenue? Lee, how much time do we have? Enough time for another question or two? Are we? I mean, I don't turn the mic off on Robin. That's somebody else does that.
Oh, show me.
Yeah. It was upside down, so I can keep going. Let's give one more question. Can we do that? Who's got something? I'll just call on Kyle Wiggins.
Yeah.
You don't have something written in that pocket square? All right. Well, thank you all very much.
Thank you.